Does COVID-19 increase your chance of being sued for malpractice? Find out on this episode of Medical Economics Pulse.
Ultimately, the test is usually going to be, did you act reasonably? So I think it's advisable to include some language about COVID in your discussions with your patients and in your documentation, but it's not a blanket protection against the lawsuit.
Will COVID-19 increase your risks of being sued for malpractice? It awaits to be seen how the pandemic will affect medical liability specifically, as so many aspects of healthcare are changing rapidly as a result of this world-shaking event. But there are steps physicians can take to protect themselves from these new risks. I'm joined today by Sean P. Byrne, a medical malpractice defense lawyer, to talk through these strategies and to explain how physicians can protect themselves from getting sued in this new normal. Sean Byrne, thanks very much for joining us today.
Yeah, thank you, Chris.
Can you talk a little bit about how COVID-19, this unprecedented pandemic, has impacted medical malpractice liability and sort of liability topics in general for physicians?
Yes, of course. So, the diversion of healthcare resources into treating the pandemic has affected us in the medical liability world significantly. So with our active cases that are ongoing, of course, our healthcare practitioner clients and experts and so forth have been really unavailable to participate in those cases. But our court system has kind of put everything on hold. So with active cases, they've slowed down and come to a halt in some cases. And then with new cases, we're seeing how the pandemic might affect those as well.
Okay, great. Can you talk a little bit about liability risks from the pandemic? I think one of the things a lot of physicians are wondering about is if I misdiagnose somebody, if I miss a coronavirus diagnosis, or if I don't have the availability to give a test and one of my patients gets sick. Can you just talk a little bit about, I think there's a lot of questions that that doctors have, and I'm wondering if you can maybe put some of their fears at ease and also kind of provide some facts about how this pandemic is specifically impacting your chances of facing a lawsuit.
Yeah, there's a number of things that come up there. I mean, in medical liability cases, the test is always, did you comply with the standard of care? So did you act like a reasonably prudent provider would act under the same or similar circumstances? Well, we've never faced the same or similar circumstances with a novel virus and a pandemic like this in the era of modern medicine. So what the law will ultimately define as reasonable healthcare services that met the standard of care is going to be evolving. We've seen a couple of responses across the state, across the country, state by state, to try to address it. So a number of states, either by executive action or by legislative change, have put in place immunity provisions to protect healthcare professionals from liability claims that may arise in this era. So a number of those state laws will say that you cannot be sued for simple negligence, which just means a mistake or careless error. You cannot be sued for simple negligence in this era for COVID-related claims. Those vary widely across the country in terms of how nimble and what the politics are and what people have done. A number of them are limited to, you can't be sued for COVID-related claims that are caused by a lack of resources. And resources can mean PPE, it can mean staffing, it can mean ICU beds. A number of states have also said, we're going to give you some protection from lawsuits if you practice somewhat outside your scope of practice, but within your license. So when we see resources being diverted from one area of a hospital or medicine to another to fight waves of pandemic patients, state laws have given some protection in those cases. So the big issues to think about are standard of care. Are you acting reasonably under the circumstances, following directives? You should know you have some immunity protections, and it's helpful to know what they are in your state as you make decisions at a healthcare professional level. And then another topic that's coming up is, what do we say to our patients, and how can we deal with the disclosure of risk?
Can you talk a little bit more about the disclosure of risk and some of these, informed consent risk assumption topics that are bubbling up as a result of this pandemic? What does that mean specifically, and what do doctors need to communicate to their patients, and in what way?
Yeah, if we start with just the fundamental that we've always got an obligation to give our patients advice about risks, benefits, alternatives. So now that we're facing the pandemic, folks have wondered, what do I have to disclose to the patient, and can I protect myself from suit? So we deal with that in a couple ways. A lot of providers have drafted, with the assistance of their lawyer and their risk management teams, a COVID-specific program. And so that will include protocols you have in place in your office for infection control, patient monitoring, screening employees, staff, and patients. We'll also include maybe some COVID-specific screening that goes into the patient's medical chart about international travel, about symptoms, about exposure. And then a disclaimer, or at least a discussion in your informed consent paperwork, where the patient has acknowledged that they're aware that by being present in the healthcare environment, they're assuming some risk of contracting the virus despite best efforts of the provider. So we're dealing with those on a number of fronts, and I've seen practices pivot really quickly to manage that risk.
Okay, so because one of the things we've heard in questions from physicians is, if I get a patient to sign something saying that they're assuming risk, that essentially wipes away my liability. Is that true? And can you talk through maybe some of the nuances of that?
Yeah, it's typically not that simple. Most states across the country have a public policy principle that says we ought not let people waive negligence. So, the back of your ticket at a ball game or the documents you sign before an operation will have some broad language in there acknowledging the risk you're undergoing, but you typically can't waive negligence claims. So those disclaimers and informed consent documents are helpful. They can be damaging if you don't do them. They can help you prove that you did disclose and discuss the risks with the patient. Ultimately, the test is usually going to be, did you act reasonably? So I think it's advisable to include some language about COVID in your discussions with your patients and in your documentation, but it's not a blanket protection against the lawsuit. But interestingly, we have those immunity provisions that have come into play in a number of states that do provide protection. What's not crystal clear is, what about the downstream issues of preventative screening for breast cancer, for colon cancer, for other significant conditions? What about the other healthcare that's being delayed? And from both lack of resources and patients not seeking care, how will our immunity protections and the standard of care address that in the future with COVID? So those are going to be evolving considerations that unfortunately are going to keep lawyers like me busy in the years to come.
So obviously tons of physicians right now are using telehealth to treat their patients because their offices are closed or patients don't feel comfortable with an in-person visit. The rate of telehealth use has just skyrocketed. I'm wondering if you can discuss if there's any unique malpractice risks as a result of telehealth, or any considerations that physicians need to take into account when they are conducting an exam or some sort of appointment via telehealth.
There are some really important considerations there. A lot of the medical malpractice insurance carriers who had very specific rules about telehealth have lessened those rules or adjusted them to accommodate the shift in delivery models and the prolific use of telehealth on short notice during the pandemic. So it's a good idea for a provider or practice group to look and see, what does your insurance carrier say about that, and have they acknowledge that it's within the scope of your malpractice policy. Similarly, state regulations that impose some requirements on how you can do telehealth and when you can do telehealth, many of those have been broadened, and some of the regulatory hurdles set to the side so that providers have easier access to telehealth. So both the legal environment for telehealth has changed. This pandemic has probably fast forward the thinking, both from a business perspective and then probably also from a regulatory and insurance perspective quite a bit. And so there's a couple things providers should check: their malpractice insurance and their state regulations as they move forward rapidly with telehealth delivery.
I'm wondering, just from your previous answer, when you were talking about downstream effects, and it got me thinking about, patients that may have serious health situations developing and aren't getting in-person care, or it's just because of the pandemic, there's sort of these barriers now to care. And I'm just wondering, like, what as a physician should you be thinking about? You obviously can't mitigate all potential risks like this. So like, what kinds of things should you be thinking about to proactively manage both pandemic risks and sort of these downstream risks that you had mentioned?
Yeah, the advice we give oftentimes as medical liability defense attorneys is that your documentation can be your best friend, because if a claim or a lawsuit develops a couple of years from now and we have to prove what you were thinking, your analysis, your careful reaction and adjustment to the limitations that were being imposed on you in your practice by COVID, good documentation of that in the chart is helpful. So if patients who are receiving routine follow-up or screening or maintenance care, and those appointments are being missed or continued or postponed, good documentation of your follow-up efforts will be really helpful. Someplace I see people fall short is, when they make phone calls to patients to follow up on abnormal lab results or abnormal imaging studies or missed appointments, but they don't document those efforts, which makes it hard for me to prove we were doing it. And so, like always, your documentation becomes really important to help you out in these uncertain times.
And the one thing I'll interject on that is right now, physicians can get paid via telehealth codes for phone calls. So physicians, we've done previous interviews with coding experts that have explained that if you're doing an old-fashioned telephone call, you can get paid right now as if you're doing a telehealth visit. So it's just more incentive to document.
I talked to a pediatrician client recently who was consulting with me in medical liability, and I asked how the telehealth was changing his world. And he said, the primary thing is I'm now getting paid for that extra couple hours of stuff I used to do at the end of the day on the phone, because I'm now doing it by video and now it's reimbursable. And it probably is a richer interaction than just the phone call, but it's certainly not as informative as being in the room with your patient and their family and having the ability to do hands-on care. So there's compromises with telehealth.
Though the one thing I'm wondering about is in terms of a physician's malpractice policy in general, do we expect some policy situations to change going forward? Like, will there be other riders that physicians should think about purchasing? Or is there any kind of like ways that you should approach your coverage that have changed? Or is it still similar considerations as we've had going forward?
There might be a great question. There might be a couple things to think about, including when quarantine rules took effect, everybody went on to lockdown, businesses shut down, the courts shut down too. And so the deadlines for filing lawsuits, which are usually matters of state law, where a patient has a year or 2 years or 5 years to file a claim, and they're hard and fast deadlines. And oftentimes insurance policies follow alongside those deadlines in terms of the scope and duration of your coverage. Those have been extended in various states. So in Virginia, here I am, for example, for 3 or 4 months, there wasn't really access to the courts. So the deadlines for filing lawsuits and things got extended for months at a time. So I think providers want to be thoughtful about that when they're looking at the business side of their insurance policies and claims. If they're using different delivery models in terms of telehealth, if they're practicing at other locations, they want to make sure those locations are accessible. If their policy talks about their scope of practice in a defined way and they're now exceeding that scope of practice, they want to make sure that's covered. And the insurance carriers that I've seen and work with have been very responsive to try and figure out how to be there as partners for their healthcare providers, right? And so they're very interested in the immunity statutes and will that provide some protection? Facilities like long-term care in particular, with the high volume of cases at those facilities, and despite enormous efforts to prevent the spread, it becomes almost impossible. And so the wave of deaths and injuries at those facilities prompts real concern about liability exposure. Many of those folks are self-insured, don't have access to enormous resources. So business planning and continuing to think about the medical liability risk and expense as you do your business planning will be helpful.
Just in general, what kinds of things, you had mentioned the pediatric client that you were helping out. What kinds of things are you hearing from your physician clients, and how do you sort of address their concerns?
Yeah, it varies widely by practice area, right? I mean, our gastroenterologists, orthopedic surgeons, the people that do elective cases were sidelined and saw their patient volumes dramatically decrease. Our dental practices were essentially closed for more than a month. So those folks have had to figure out how to get going, how to sustain themselves economically, and what things look like when they return. Urgent care, emergency medicine, those providers really have shifted their focus into testing, preventative measures, and being prepared for COVID. So it's affected each practice area a little differently. We get calls for risk management and compliance advice in this area, and people are thoughtful about when can I safely reopen. When the state governments imposed restrictions on elective procedures, there's debate about whether a particular procedure is elective or medically necessary now, and it probably depends on your perspective, whether it's you or your loved one, and it's your practice or someone else's practice. So we've had some debate about that. We've seen a few board of medicine complaints with unsatisfied patients saying, hey, my procedure was postponed as elective, and it shouldn't have been, and I want to move forward. I think the board of medicine won't have a lot of sympathy with patients who make those complaints when they know the providers are doing the best they can.
Okay. My last question is just, is there anything else in terms of malpractice, in terms of this pandemic in general, that you think it's important for physicians to know that we haven't talked about?
Yeah, I mean, a really interesting thing to me is ultimately malpractice cases come down to convincing a jury that you were reasonable, and the cases where we clearly made a mistake could get settled. The cases that are frivolous nonsense, we fight to the death. The cases in the middle come down to jury perception on, were you a good physician working hard to do the best you could for the patient under the circumstances? And so in this era of healthcare heroes across the board, it'll be interesting to see how juries respond to medical malpractice cases. A lot of plaintiff attorneys who are well regarded, very selective in their case management and decisions, have said publicly, I don't want to take COVID cases when I understand the crunch that the providers are under. So whether the future brings more medical liability lawsuits raising out of COVID or fewer, and how it affects jury perception is a real unknown. And I think what providers can continue to do is focus on good charting, good relationships, staying up to speed on the developments, and hopefully they will stay in the medical facility and out of the courtroom.
Sean Byrne, thanks for the great conversation today. I really appreciate it.
Thank you, Chris. Appreciate it.